Hey, it's Dr. Danny Dowling. So now that you've eliminated some of those fermentable sugars like the high FODMAP foods from your diet, my second recommendation is going to be revolved around using herbs. And I'm just recommending herbs that you might already have in your kitchen, ones that you're cooking with, or that you might already have teas. Those are going to be really awesome in this regard. So what are the things we're looking for in these herbs? When I'm talking about herbs and the way that I was trained in Western herbal medicine, we focus a lot on the actions, the properties of the herbs. And the cool thing about herbs is a lot of herbs have multiple actions, but today I'm going to focus on 2 or 3 that I want to make sure you're getting into your diet if you are dealing with gas and bloating, and those are bitter, carminative, and demulcent. And what those mean, so bitter obviously tastes bitter, but why we want that is because bitters stimulate digestive secretions from the liver, from the pancreas, from the stomach, and that's going to help you better digest your food, break down proteins, get minerals from your food, and it's also going to help prevent some of that gas. So if you're not digesting things as well, you're going to be fermenting foods and creating more of that gas. And the next thing is carminative herbs. So those are specifically great at alleviating gas and bloating and some of the digestive discomfort. Pretty much every herb that's on your spice rack, things like anise, caraway, chamomile, cumin, coriander, clove, dill, fennel, garlic, ginger, lemon balm, marjoram, motherwort, mustard, nutmeg, onion, orange, oregano, parsley, pepper, peppermint, rosemary, saffron, sage, savory, spearmint, thyme, valerian, and spearmint. So those are mild digestive irritants, so they help stimulate peristalsis and help keep things moving through the colon, through the intestines, helping prevent and alleviate gas. And then the third one is demulcent, and this is when I think of mucus. So it helps support that mucus layer that protects the cell lining of the stomach, of the colon, and it soothes the tissues. So any of these conditions that have inflammation or irritation, demulcents are going to be really helpful. The first one that comes to mind is marshmallow root. There are other ones like aloe vera, things like slippery elm. So these are going to be herbs that you can get into your diet that are going to help soothe and coat. And if you're dealing with things like acid reflux, heartburn, peptic ulcer, so a lot of those really irritated tissues are going to be soothed and helped by demulcent herbs. And if there is a ton of irritation, I will recommend against using some of the carminative and bitters just because they can irritate if you are in a severe situation of GERD, so gastroesophageal reflux disease. Take PPIs, H2 blockers, things like that. It's basically not going to work because you're blocking your parietal cells that are secreting hydrochloric acid. And the important thing with these herbs is that they're gentle, they cover multiple areas, so they help stimulate digestion, protect the cell lining, and they've got these volatile oils that stimulate the vagus nerve, so help with calming and resting and digesting, and that's what that parasympathetic aspect of the vagus nerve is responsible for. Vagus nerve comes down, wraps around your heart, wraps around your diaphragm, wraps around your stomach, and helps keep everything moving slow and calm and grounded, and is responsible for that homeostatic balancing aspect of digestion and heart rate and breathing. So important to get some in your diet, and these are really easy. These are things that people already have in their kitchen. So this is what I love about this medicine is utilizing the things that you already have in your home and in your disposal, and that's why this is powerful medicine. It's the people's medicine, and giving these tools back to the people and educating them. And I didn't know about any of this before I went into naturopathic medicine. The power of botanical medicine and how easy it is to use and how powerful it can be. So if you have any questions, again, this is educational material. This is not meant for medical guidance. So If you have any severe concerns, medical concerns, please reach out to your local naturopath and get a holistic view and a full workup, and make sure that there's nothing that's contraindicated in your case, because of course we're not trying to do any harm here. This is just for the general population if you're dealing with some of the mild issues with discomfort and pain from bloating and gas. So thank you, and I'll see you next time.